We were always taught that the healthiest way to start your day is with a nice whole grain cereal breakfast, right? We actually moved away from high protein, high fat diets because everyone was told that that's why heart disease developed. In fact, it's the opposite, right? Hey everybody, it's Dr. Bob Hariri from Piloting Health with Dr. George Shapiro. We're at the Abundance 360 longevity trip here in San Diego, California, and I've had the great opportunity to pull George out of the speakers pool and get him to talk with us about what's going on at Fountain Life and in the all the areas we're working together to bring cutting-edge regenerative therapies and precision diagnostics to all of you out there. So, George, welcome aboard.
Well, it's great to be here.
So, George, you and I have known each other a long time. Give everybody a little bit of your background. You're a cardiologist and a regenerative medicine expert. Tell everybody about yourself.
Yeah, I'm in medical practice now for 35 years. My focus was cardiology, sick care model. I trained at Columbia University where I was a cardiology fellow on the transplant team. Our goal was to really take care of the person with heart failure. So we used new technologies back then, and unfortunately, when you're in heart failure, there weren't too many options.
Mm-hmm.
So some of the new things that we've done, has changed. But throughout my career, I started to feel tired and started to get less energy, and we were working maybe 8 hours a week, so it was a lot.
Right.
So I tried to investigate aging. So I went to a company in Vegas that they really looked at your hormones, your metabolism, your nutrition, your exercise, and I was doing everything wrong.
And how long ago was this?
This is about 20 years ago.
20 years ago, yeah.
So I was in my 40s.
Right.
So typically men in their 40s tend to go through this. Some people call it a midlife crisis. Some people just call it, andropause.
Yeah.
Andropause is a big term.
Yep.
So for me, everything was wrong. My metabolism was slowed down. And, I was always fit. I was a huge racquetball player. I toured the country when I was younger. I did martial arts. I went to the Olympics as a junior Olympian. So I was always fit, and I couldn't understand why. I'd wake up in the morning and my joints would hurt. My belly would be bloated. Something was wrong. So after, months on this program, I started to get back to where I was when I was younger. And they wanted to expand out of Vegas. So they went to New York, and I became the president of this company in New York City. Mm-hmm. And I was doing that for about 15 years as a parallel track when I was doing my cardiology insurance-based practice. Mm-hmm. So I learned about concierge medicine, age management medicine. And one of the patients who came in was actually Tony Robbins and his wife, Sage Robbins. So we became really close. So while I was in Wall Street, we were working on a group called the Optimal Wellness Group, where we took care of some retired football players from the New York Giants. And the goal was to try to see where they were at baseline health. Turns out that a lot of them were hypertensive, overweight, on chronic pain meds, full pain syndrome just from football injuries.
Right.
They weren't eating right. We actually went to the supermarket with them, with the film crew, and saw what kind of foods they were eating. And they were having saturated fat, whole milk, all the things that we're told not to eat when we want to be healthy. And it was a 6-week program. We got them very healthy, and then we closed them both at the New York Stock Exchange. And that's when I met you about 15 years ago. And then we were talking, and you said, let's start a company where you can deploy clinically your placental stem cells. And I met with Dr. Bill Kapp, and then you met with Peter Diamandis and Tony Robbins, and we formed Fountain Life 4 years ago. And that's how it started.
Right. So interestingly, you transitioned from kind of conventional cardiology, and you call it sick health, right? Sick-based health, where the objective is to only intervene when patients come to you with symptoms, evidence of an underlying disease process. And you and I both recognize that that's kind of a backward way of dealing with things. By the time somebody is symptomatic, the underlying process has already, in some cases, become irreversible or difficult to reverse. So talk about, as a practicing doc and cardiologist, why it's so important to actually get in there and preempt these diseases.
So it's an interesting point. The last thing you want to do is see the patient. Well, as a physician, that's what we do. We do sick care. So we'd see a patient coming in with chest pain, diagnosing a heart attack. It would be great if we can do a test 10 years before that and say, okay, you're going to have a heart attack. Let's prevent that heart attack from happening. So that's really the basis of Fountain Life: early detection of disease using new advanced diagnostic therapies with new technology, such as AI. So one of the technologies we saw was looking at, coronary arteries with plaque in a way that we can see plaque years before
So let's explain that.
it get dangerous.
So let's explain that. What do you mean by plaque?
So as we age, we have deposits of plaque in our coronary arteries. It starts off.
So in the lining of the blood vessel, right? The lining of the blood vessel, you wind up getting accumulations of abnormal tissue, right?
So we have 3 layers of blood vessels: the intima, media, and adventitia. In the blood vessel wall, we start to see some sort of an injury. And the injury starts and then accumulates macrophages. They come there to the rescue. And before you know it, you have this foam cell and you have LDL particles, and you start to develop this plaque with lymphocytes
and inflammatory cells, and ultimately media. So just to explain to everybody, the inner lining of the blood vessel, the intimal layer, right? When it's injured, responds to injury with inflammation. And inflammation drives the accumulation of abnormal cells and byproducts of those cells, which includes, as you mentioned, the foam cell, which is kind of a lipid-laden cell. And in some cases, it can progress even to calcification, right?
Right. And it turns out there's a covering of this plaque, and it's called the TCFA, TCFA.
Mm-hmm.
It's a thin cap fibroatheroma or thick cap fibroatheroma. What makes it thin and thick is very important, because if it's thin, it can rupture, and it's a vulnerable plaque, and it can rupture like a volcano, and you have an eruption or a heart attack. So we can do different things to help us with these plaques.
Yeah.
One of the things that we could do is we can reduce the amount of inflammation in our body. And by doing that, by lowering certain mediators, we can make this plaque thick, strong, and solid.
Yeah.
So now we can actually identify plaque and look at the color of the plaque using AI and tell whether it's a stable plaque, a soft plaque, or a dangerous plaque.
See, so people need to understand that the normal aging of a blood vessel leads to changes in that inner wall. If you think about it as like a 4-lane highway, right? A 4-lane highway that's narrowed to a 2-lane highway, which is narrowed to a 1-lane highway, is much more susceptible to being totally blocked if one car has a problem. Same thing with blood vessels. As the lumen, or the inner area of the blood vessel, becomes shrinked because the walls are thickening, you have a higher probability of that blood vessel becoming occluded, blocked, if a plaque ruptures and leads to thrombosis, right, blood clots. So what you're saying now is that one of the approaches at Fountain Life is to use high-resolution imaging and AI techniques to identify the nature of the obstruction or the potential obstruction and how to deal with it.
Exactly. We can actually look at your vessel and predict what's going to happen based on blood biomarkers. So we looked at about 4,000 patients so far who came through with these heart scans, and we looked at biomarkers, and we used large language models and AI algorithms to see what biomarkers were associated with coronary plaque volume. So I've been going to the American College of Cardiology annual meetings, I think since I started 1994 as a cardiologist, and everything is about how low to get your LDL cholesterol. And it turns out that it's getting lower, 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 and lower. But what we found out on the biomarkers, actual data, we have the largest asymptomatic population of data out there yet. And it turns out that the 5 top biomarkers are hemoglobin A1C,
right,
number 1.
And who first told you about that?
Dr. Hariri.
I have been convinced that blood glucose and the chronic exposure to high levels of blood glucose are far more dangerous than what we used to consider the culprit, which is lipids.
Right. Well, glucose destroys the endothelial glycocalyx, which is the inside lining of our blood vessels. And by the way, we have 60,000 miles of blood vessels in our body. I think it's the largest organ. I mean, some people say skin, but if we have 60,000 miles of blood vessels, that inside lining is so important. It's supposed to be as smooth like an ice skating rink.
Right.
The problem is, certain times it's not. It's like a garage floor with epoxy paint and sand on it. It becomes gritty, but everything sticks to it.
Yeah.
The plaque sticks to it.
Yep.
So the one biomarker that was most common with correlating with coronary plaque volume, the hemoglobin A1C, guess what number 2 was? Insulin.
Interesting. So the hormone responsible for controlling blood sugar is a culprit.
Right. And one of the big reasons is when we have a sugar meal, sugar rises and insulin comes to the rescue to lower it. The problem is your sugar will bottom out. Insulin takes a long time to come down. And by the time it comes down, you're eating again and your sugar rises. So starting in the morning, if you have a bagel or a donut, probably the worst things you could eat, you're setting up your whole body for a metabolic problem the whole day, because high sugar and high insulin bind free fatty acids.
Yep.
So you stay fat, and fat's inflammatory. And
so think about it, right? From the time we were kids, right, until the time we were professional adults, we were always taught that the healthiest way to start your day is with a nice whole grain cereal breakfast, right? We actually moved away from high protein, high fat diets because everyone was told that that's why heart disease developed. In fact, it's the opposite, right?
the same commercials I heard, eat your Cheerios, lower your cholesterol.
Right.
Cheerios have a glycemic index of 85. It's pure sugar.
Unbelievable.
The worst thing you can possibly eat in the morning.
And chasing cholesterol, which became an obsession of the conventional healthcare system, in my opinion, may have been one of the most maladvised approaches you can imagine. People think that cholesterol is the culprit. I challenge that.
So that brings an important point. There was two other biomarkers associated with coronary plaque volume: uric acid and oxidized ApoB. ApoB is part of the LDL particle, but oxidized means it's inflamed. So it's looking like inflammation and glucose. Both are problems. Another biomarker that we looked at was homocysteine. And I remember during the early years, there was a big controversy between homocysteine. Is it really bad? Is it not bad? There was an abstract at one of the cardiology meetings that showed accelerated atherosclerosis from homocysteine. And this is months after it was published in the New England Journal of Medicine, that there's no correlation. But obviously there is in an asymptomatic healthy population. So when we look at all these biomarkers, guess what was not really correlated with plaque volume? Total cholesterol,
Yeah.
LDL cholesterol, triglycerides. I mean, those are all problems,
Right.
to talk about. But I mean, the main thing was sugar and inflammation. And statins work by reducing inflammation. It's an anti-inflammatory drug. It also lowers your LDL, but I don't think lowering the LDL is reducing plaque volume. I think it's reducing the inflammation.
Exactly. So it's funny. 35, 40 years ago, actually 40 years ago, when I was doing my PhD in vascular biology, I remember proposing to one of the cardiology attendings and professors, I said, I think that vascular disease, arterial atherosclerosis, is actually an inflammatory disease. And I think that hardening of the arteries, which I used to call, I said, I think what that really is reflective is in inflammation-induced degenerative vascular disease. I would rather that terminology rather than atherosclerosis. Atherosclerosis suggests that the atheroma, right, that lesion, that fatty lesion, hardens the blood vessel, but it's actually a consequence. That's not the causal reason. It is the consequence of inflammation.
Right, so why do people get inflamed? What's chronic inflammation about? The problem is our metabolism slows down, and 60 seems to be the magic number.
Yeah.
After age 60, your DNA changes and everything changes. Your blood vessels, instead of being compliant and rubbery like a garden hose, become like a steel cast iron pipe. And most people I know over 60 need blood pressure medications because their endothelial glycocalyx gets damaged with age because of all this deposition of particles from inflammation. So inflammation starts at a young age, and we can prevent inflammation by just exercising.
Right.
So one of the things that most people get in this rut, they stop exercising.
Yeah.
It's extremely important to do your steps each day. I try to set it up for it's 10,000 steps a day, so I'm accountable.
Yeah.
With an app, you also want to at least lift weights 3 to 4 days a week.
Right.
Longevity is about, as you know, muscle.
Yeah.
Where are the stem cells in the muscle? So that's, you've been talking about stem cells for a while, but
Right.
a lot has to do with how to reduce inflammation.
And that you want to give people information that's actionable, right? And so the beauty of exercise, load-bearing exercise, not aerobic, not the sort of the aerobic exercise everybody was obsessed with for decades, right? The long distance running and so on. Although that there are certain benefits to that, right? The truth of the matter is that load-bearing exercise and something as simple as simply walking at an incline has tremendous benefits. It's very easy to accomplish, and people can make it part of their daily routine.
That brings us into zone 2 training. Walking up a hill, you're going to get to that zone 2 level.
Right.
Zone 2, we do performance testing to look at your zone 2. So we'll do a baseline finger stick lactate, put you on the treadmill, every 3 minutes, increase elevation, and keep doing finger sticks till your lactate's between 5 and 6. Then we look at your heart rate, and that's your zone 2. It's for me, it's 104 to 107. It's low. It's not high. But that high intensity interval training where you should do once a week is about 140, 150 beats per minute of heart rate.
Right.
So zone 2 is really important.
Right.
But some of the other things that we do at Fountain Life, besides doing early detection of heart disease, we're looking at the brain. So we're doing new testing of the brain to look at your brain age using AI algorithms to look at, how's your brain aging? Do you have any biomarkers that make you susceptible to dementia?
Right.
And that's a big thing. And what we're finding out is inflammation, another cause. Chronic viruses in your body, another cause. Retroviruses have been associated now with neurodegenerative diseases.
Microplastics. There's lots of things which ultimately find their way into the system that can stimulate inflammation and can be at the root cause of the process which we now kind of understand is degenerative cardiovascular disease.
Did you see that article that was published recently where they cut open a clot?
Yeah.
And there was plastic inside the clot.
Right. Right. I mean, listen, it's for me, it's shocking the amount of plastic that we have deposited into our environment, and there's almost no way to remove it. So
we actually measure plastics. We do a toxin test. So we measure BPA, we measure other environmental toxins. And after doing thousands of patients, you can't believe what we're finding.
I believe it.
Food toxins, environmental toxins, heavy metals.
Yeah.
There's more heavy metals we're seeing now than ever before.
Oh, I know. Did you see the report that in cinnamon you buy in stores has got lead in it?
Chocolate.
Chocolate.
Lead.
Yeah.
I mean,
oh my goodness, you're making me very depressed. But here's the bottom line: Fountain Life is now trying to disrupt the conventional sick care model for a well care model, right?
Right.
And create strategies that allow people to preempt disease rather than approach it only when symptoms have arisen.
What's really interesting is we're answering the question, why? Why does this person have disease? No one's really doing that. So we look down at the cellular level, and I remember in second year medical school, you probably remember biochemistry, the TCA cycle, the Krebs cycle, the electron transport chain, and you thought you'd never see it again. But we have trillions of cells with 1,000 chemical reactions in each cell. And the goal is to make ATP, energy. We're supposed to make about 100 pounds of ATP every day. Most people only make 20 pounds. Their engine is not working because heavy metals or endocrine disruptors or other toxins are screwing up the cycle. So we answer that question, why, find it out. Now they have energy again. They want to go to the gym. They want to exercise.
Right.
But there's other things we could talk about, sleep and other therapeutics. But
we got to save that for the next episode.
But regarding diagnostics, one of the diagnostics that we like to do is look at cancer. So as you know, we had an interesting talk today about, cancer, metastatic cancer. And metastatic cancer is very resistant to chemotherapy and radiation therapy. There's a lot of new genetic companies out there doing a genetic profile on cancer if you get diagnosed to see what drugs can treat that cancer instead of blindly just giving chemotherapy.
Right.
But it's one of the new therapeutics. I mean, as part of the innovation program in Fountain Life, I constantly search for new innovations.
Right.
So, some of the new innovations that we had relating to cancer is a new filter that can filter out circulating tumor cells. And we're really looking into this now because if we can lower the tumor burden by 10x as your blood gets filtered through a dialysis procedure, your immune system gets redeployed and builds up again.
And we have to find a way to couple that with NK therapy. Right. It'd be ideal to use the same approach to clear circulating tumor cells and reduce the incidence of metastases by basically, in a precise way, clearing them using nature's best tool, the NK cell.
Right. So what's the best way to have your immune system deployed? You want to make sure your microbiome is good.
Right. And you have to have the right levels of vitamin D, zinc, C, et cetera.
Yeah. So we actually look at both the gut microbiome and the oral microbiome. But one of the things that we're concerned about is keeping your immune system strong. So with age, we lose part of our immune system. It gets weaker. So we measure immune age. And one of the things that we're excited to work with Cellularity is looking at xenoablative therapy.
Right.
and looking at ways to boost your natural killer cells. So,
Right.
so you can actually draw blood now, store it, grow our natural killer cells, and then give it back to us when we need it, when we're sick, God forbid, to be redeployed at a certain later time.
I think that that's going to be a very, very important breakthrough in advance going forward. A lot more to talk about. This is a great entry
I just want to
point.
leave with three things. The main goals of Fountain Life is early diagnosis,
Right.
early treatment, and early cure.
Love it. Well, listen, George, thank you for joining me, and looking forward to continuing to educate everybody about what we can do at Fountain Life and where cellularity will ultimately be able to deliver these cutting-edge cellular therapeutics to the Fountain Life system to make available to everybody.